Hello, my name is Dr. Fritz Brink. I'm a general surgeon that works over at HCA Florida Pasadena Hospital, and my outpatient clinic is in the medical office building across the street, which is HCA Florida Pasadena Surgical Specialist. As a general surgeon, I cover a lot of spectrum of different types of surgery. Primarily with general surgery, if we're talking about things on an outpatient basis, we're talking about lumps, bumps, hernias, colon cancers, gallbladders, and breast surgeries. Now there's been an even greater advance in the technology associated with minimally invasive surgery that involves utilizing a robot to do surgery. Now the surgeon is in full control of the robot the entire time. This isn't you go and sit in the room and the robot does the whole surgery for you. The surgeon has the ability of having three-dimensional vision because there are two cameras at the end of the camera that's inserted into the patient's belly, so you can see depth as well as a much higher detailed picture. And the instruments that are utilized for the robot involve wristed instruments. So instead of having a long stick with just pliers or pinchers at the end, you have the ability to use the entire function of a wrist at the end of the instrument, which allows you to go around structures, to move things out of the way in ways that you can't do by itself laparoscopically without adding more port sites or putting a lot more tension on tissues that you otherwise want to try to minimize the amount of tugging, pulling, and retracting that you're doing. Both me and my partner, Dr. Prebish, are very, very focused on patient individualized care, where we are not running an assembly mill at one of the big giant hospitals where people just come in, it's like, oh, hernia, check the box, schedule them for surgery, they go and get their surgery done. It's very much about having a discussion, taking some of the fear about surgery away and educating a patient more than just saying, this is your condition, this is how it gets fixed, and when do you want to have your surgery?